Good afternoon, everyone, and welcome to our weekly COVID chat. We've been doing this for a couple of months now, and always good to see everyone. We've got a really good program for you today. We're going to talk about testing quite a bit. We're going to have a couple of folks from PVN and Forefront Living to talk about how they went about testing their entire campus and how all the logistics surrounding that and what it taught them, and where do they go from here. So I think some good lessons to be learned there. We'll also get an update from Elise on what's happening with testing, with reopening plans, with survey plans, with PPE shipments from FEMA. And then Ann's also going to give us an update of what's going on from sort of a PPE supply side. So a full agenda. So let me go ahead and also want to remind everyone, if you have questions, to please go ahead and type them in the group chat, and we'll relay those to the presenters. And so anyway, hope everyone had a good weekend. I want to introduce Brian Cooper. He's Executive Director of PVN, and also Joni Watson. She's Director of Healthcare Operations. So I want to turn it over to them, and they're going to talk about how PVN went about testing that they did their entire campus, including their independent living. How they communicated that to residents and their families, how they made the whole process transparent, and how this is going to help them moving forward. So, Brian, I'm going to turn it over to you.
Thank you, George, and it's nice to be with you all today. As many of you know, we all started navigating these waters back in March, and it's hard. It's going to be hard to summarize everything that we have done in these past basically 8 to 10 weeks, but I'll try to be brief, but also detailed enough to give a little bit of insight. Obviously, just like many of you, we learned as we went, but we gained some really good information for us that I think has beneficial for our operation. It was really back in really the end of March and the beginning of June, when we had kept at bay the virus from entering our campus. We sit on 65 acres. We have a little over 500 residents, and then about 400 to 450 employees at that time. And once we had a therapist actually, who had started exhibiting some symptoms, and this person decided to quarantine himself, eventually went to the hospital, got tested there, but was released, didn't have the results back. And so we went ahead and tested this particular person. And the same day we got our results back, the hospital did as well. And obviously it came back positive. We then took it from there, obviously, to look back in time and do some tracing, and then also test all the therapists. We had another therapist come up positive as well. So at that time, we decided, okay, we've tested all the therapists, but I think we need to take this another step more. Can we find labs that will allow us to have access to the testing supplies, and that can get us the results quickly? And we were able to do that. We actually partnered with 3 different labs, and we went ahead and tested everyone. We started with residents in our skilled nursing, and I'll show you a little graph here in a minute that shows you all of the testing that we did. But we started with skilled nursing. We went over to assisted living, and then we obviously finalized independent living residents, and also a fair amount of what we call contract workers or miscellaneous workers. All of your caregivers and sitters that we've had. Through it all, we tested a little over 950 tests that we completed. And about 2.3% of those were positive, or we had 21 cases. And to date, we've had about 12 that have fully recovered. And I'll share my screen here so you get an idea of what this looks like. You can see the broken down in teammates and our skilled nursing residents, our assisted living residents, and our independent living residents, our therapists, and then of course miscellaneous, which would include the majority of sitters and contract workers. I think one of the main things that really helped us as we did this testing was our ability to communicate out to residents and family members. So every day at 1 o'clock, which I'm missing today's call, but someone's covering it. I have a Zoom call with our resident council presidency in independent living, and then what we call area reps. And so there's about 10 to 12 individuals on this call from independent living that are actually obviously residents. And we discuss in detail both testing, positive cases, different things that go on each day, any changes in processes or policies. And then of course, right now we've been talking in discussion, reopening and how we do that in phases, in cycles. So the other thing that we did was we went ahead and did a Zoom call with all of our assisted living family members, and we did a series of this. So we had, I believe it was 4 separate calls, and allowed them really to get an understanding of what we were doing, and then allow them for for question and answers. And that was very, very helpful. I mean, it allowed us to be vulnerable, but it also let them know that we were transparent with what we were doing. The other thing that was very helpful for our standpoint was the ability to, once we found cases and they came up positive, we were able to isolate them in a completely separate building. The building that is licensed for skilled nursing, but we were not using it at the time. So separate entrance, separate area for our teammates to obviously shower and decontaminate. And it has proven to be very helpful in that area. I'll pass it over to Joni, and she'll be able to talk about, how specifically we were able to access tests, because I know that's a hot topic, or has been, but also where we were able to get PPE and how we were able to continue to keep our supplies up.
Okay, hi everyone. Yes, we did. We were able to, and still are able to, access testing. Initially, we received some testing from one of our suppliers, and we recently opened an in-house lab at PVN, and just at the beginning of the year. So the lab supplier was able to provide us with some testing because of that relationship. We also have a physician partner who helped us and had access to a lab, helped us do the testing with primarily our assisted living residents. And then we used 2 other labs, Magnolia and MedScan. I don't know if you know MedScan labs. So MedScan is in Katy, Texas. So it's a little further away, but they've been very good about returning things in usually about 48 hours. We have, we've been fortunate also to have the rapid test, which initially that's the only test we had, but it has become valuable in our COVID unit. We have 5 people in our isolated unit. So those tests are valuable in determining whether or not somebody should really have the nose swab. So we've had access to all those. PPE, various sources. We've had different vendors, and some of it is like if you have Medline or McKesson that usually supplies your equipment, they're usually really helpful. I think I've worked with you all a lot on the LeadingAge network has that PPE supplier too. So that's been helpful. we've had various people contact us. I think some are in the business because their business couldn't operate during this crisis. So they've started making gowns and such. But I think having one person be the point person for PPE and everybody just send their information to them. I receive emails daily about things that are available to me, and I think it's helpful. Also, we've separated a supply area for just our COVID-19 supplies so that we can track and keep a log of them daily and know where we are. And it helps if just a few people are involved in that process to keep it clean.
November, December.
Brian?
Yeah, so thank you, Joni. So really, being able to do this testing at this magnitude, it gave us a picture in time of, do we have cases and where are they? So that we were able to isolate them. And the biggest thing was prevention for any of the virus to spread. We were able to localize it and then obviously segregate it and isolate it in one area, and obviously proved to be very beneficial from having to take care of any more cases in the future. George, are there any questions that we can stop and answer?
We had a question, where did you make rapid testing from?
ClearWave is the lab that opened our initial lab in January. We opened the in-house lab. As I said, they're the ones who helped obtain the.
Okay.
And we can send that information out if people are interested in knowing where to order or how to obtain.
Sure, absolutely. I've got a question. How is this, you mentioned about reopening and how this is going to sort of gauge how you reopen. How is the testing sort of figured into those plans? And what about like future testing? You obviously have access to testing. How are you going to determine who gets tests from this point forward?
It's a good question. What it really did for us is it gave us a baseline. It at least gave us a starting point and understanding at this point in time, who do we have that is affected or not affected, or at least tested positive or not. And then it has allowed us to get a feeling of, what areas of the campus are more vulnerable than others. And then to really hone in and look at, okay, what factors go into each area? Are there any exposure? And then it definitely has helped us understand and have discussions really with our residents. It's definitely been more of a team approach on being able to answer questions and decide on timing on when to reopen. We have reopened the campus and have started doing that. Understanding that rather than we don't know, we at least do know in these certain areas that we have not had any positive cases, and how do we keep them safe but continue to move forward cautiously and allow a little bit more freedom on campus.
I think too that it's important to know that we understand it's risky and scary to do this much testing. The mass testing was a long thought out decision, but I think it does help everyone on your campus and their loved ones to feel comfortable that you're being transparent about everything. And at least then you know that you like Brian said, we have a baseline, we know where to start, and we know that it's not lurking somewhere. I think that's been the most valuable thing that we've learned. The families are very, very grateful.
And to answer the last question I think you had, which was in terms of retesting, when do we do the retesting? We have tests on site right now, and it's really more now, we're taking it more on a case-by-case basis, based on symptoms, based on exposure to anyone else. And we haven't looked at doing a mass retesting again. This is more based on individual circumstances and symptoms.
So you're basically going to, like if somebody exhibits some symptoms, you're going to have them go through the test again.
Correct. We will quarantine, test, and wait for the results to come back. fortunately, the labs, especially, some of our partnering labs, they can get a test result back to us within 24 hours. Sometimes it takes a little bit longer depending on lab volumes, but they've been great to work with.
Well, yeah,
It's
obviously.
important if you get a positive result, doing that contact tracing is really important.
Are new residents? Yes. No, what are they?
Okay, sorry about that. So the, obviously the state now is testing every nursing home in the state. And so you mentioned the lesson learned is that you get a baseline. How should, if a community out there gets test results and they see a couple of cases, what do you advise them is the best course of action?
Go ahead, Johnny.
Well, I just think that if you do get it's like Brian said, we isolate, and then if you do get a positive result, it's a matter of anybody that they've been in contact with. I mean, that's the way we did it. You have to look at it from an aggressive standpoint. I think, it's better to do more than less.
Yeah, I would say that always err on the side of caution and act quickly and be decisive in making sure that you really look around any and all individuals who might have had contact with that individual and get them tested quickly.
The question that I hear coming up is, what if staff are resistant to taking the test? Did you have any staff who did not want it or resistant to it, and how did you deal with that?
We had one individual, and that individual chose to no longer work at the campus. Okay,
all right. And what about your independent living residents? Because again, it's unregulated. It's obviously their choice if they want to get tested or not. How did you convince the independent living residents that it was in their interest to do this?
That's a great question. And really it boiled down to a discussion. Also, we sent out a letter just letting them know that testing isn't just for your own safety. For the most part, it's for the safety of those that live around you and who you come in contact with. We obviously had some cases that were asymptomatic, so you don't necessarily know who, even if you do contract the virus, you don't necessarily know it. And so really it's more education and understanding, your protection of others is demonstrated by your willingness to jump in together and get this done. Now, we didn't have a full 100% of our independent living. We had about 35 folks who decided, not to get tested. And in the end, George, like you said, that's really up to them.
And I think what was interesting was I think some may influence others, some that were tested, because it's like after the initial residents signed up for testing and the others weren't going to do it, there were several more that ended up doing it pretty quickly, or they'd call and say, hey, I do want to get tested. So I think once they saw that it wasn't such a scary thing, and I think I wanted to mention earlier too that, the testing is not perfect yet. There's still that rate of false negatives. And they just put out a news brief I saw the other day on the national news that about 35% of people were receiving false negatives. And I think if we did our own little study, it was about 30%, about a third we would get that, especially that we knew if somebody came back with positive, we isolate them, they're in our unit. We have to have 2 negatives for them to come back out. And we were seeing about that rate of false negatives just in the positive people that we saw.
Wow, okay.
And also I would say that, some independent living residents, they had valid reasons for not wanting to get tested. One of their main one was, I don't want to take up a test, because tests are so crucial and so precious. I don't want to, take that up. I will choose to quarantine myself for 14 days rather than use a test. So.
All right, good point. Can you share what you've opened on your campus at this time?
Yeah, so it was about not quite 2 weeks ago. We went ahead and opened up our. We found that there were 3 things that were heavily coveted at the campus, and the first and foremost was our beauty salon. Wholeheartedly, people wanted to get their hair done, and so we went ahead and tested the beauticians, the stylists, and waited for their tests to come back. And once they were negative, then we went ahead and opened up. And obviously we opened up with, restrictions, have to wear a mask, gloves, no more than one in the, salon at a time and things of that nature. So we opened that. Just yesterday, we went ahead and opened our lifestyle fitness center. And we have, quite a bit of space in this fitness center, but we obviously limited it to a number of 4 people, and then obviously just had them sign up at various times. We also allowed people to, it was about a week ago, we allowed residents to go ahead and go off the campus for more than just essential visits. But what we've seen with that is even though we opened the door, so to speak, and there's our residents have really shown that they want to protect themselves and the campus because we haven't had a lot leave yet. So those are the 3 main areas we've done. We are now looking at in the future to allow some visitation to come on, albeit that will be restricted on how we do that. No common areas, go directly to the residents' apartment or home. So those are some of the things that we've done to open the campus.
How are you handling new hires? Do you require them to go through a test before you hire them?
We have been, yes. We have done that in the past, yes. And honestly, right now, we don't have a lot of new hires right now, but the ones that we have tested.
Okay, good. This question was, or I think you've already answered it, testing private duty sitters, and that was a lot of the folks that you had tested in your chart there. And who's responsible for the cost of that testing?
Well, so we with one of the labs, we had a physician that partnered with us, and they went ahead and billed the individual's insurance. But with another lab, we obviously just consumed that cost. We took on that cost ourselves.
And what is your plan for your independent living dining room?
That's a great question. That is part of the reopening phase. We have not, broached that topic quite yet. We're still kind of in the wait and see mode, especially with how, Dallas County, if they allowed to open things up, we wanted to see if numbers have increased as well, both from a case standpoint and a death standpoint. That's probably one of the last things that we will do to open up. We will change things up in terms of number of people at a particular table. We used to have a salad bar. We won't have a salad bar anymore. So that is yet to be determined, but it's something that we will see some changes.
Okay. Let me just, does anyone else have questions? Feel free to type them in. Did you have any residents who did not want to be tested, and how did you handle them?
So really the only area we had residents that didn't want to be tested was independent living. We did our best to provide education, and they did get some peer pressure from other residents. But for the most part, that was their choice from an independent living standpoint. All others really complied, and for the most part, they were grateful that we had access to the testing and that we were taking the time and expense to go ahead and do it.
Can you give a range of how much the testing costs per test?
Yeah, it's about $100 a test.
Okay. All right, good to know. I think some people are very jealous of the 24-hour turnaround time because people are waiting days, if not weeks sometimes, to get their test results.
Well, initially when we first started, it was a week or 2 weeks. And, we found, some lab partners that helped out with that. Now, 24 hours is very fast. And usually it's, 48 to 72, but we'll take 72 hours over a week or two.
Right.
And it kind of depends. The weekends, a lot of the labs still are not open on the weekends, which I'm surprised about. But so if you have a test that you do on Friday and you deliver it to them Friday evening, it will be Monday or so, or Tuesday maybe.
How does your COVID unit set up and what do your teams look like? And what kind of shifts are they working?
Well, we have 3 shifts. We work 3 8-hour shifts. So it's a completely separate building. So separate entrance and exit. They don't see the staff that are working on the COVID unit do not work anywhere else on campus. And, depends on, I guess, your number of patients. But right now we always have a nurse there and a CNA. We're able to deliver any kind of equipment they need or dining. We're able to deliver that without going into the unit. We're not having housekeeping go in right now. They're able to, nursing just does the disinfecting of the unit right now. So it's been, I think that's really where we've been most fortunate is we had the space to do that. We started planning mid-February, I guess, and we did identify that area is if we had it. We were hoping we didn't, but if we had it, this was our plan. And that helped a lot to have the plan because when it did happen, it was a smoother transition because of that.
Very much
You
so.
have to pay your staff a different enhanced wage to work in the COVID unit?
We did.
Okay.
I might add that we also have therapists working up there. I think my biggest concern once it happened, you start looking at the rehabilitation and recovery, and I think we were very concerned that therapy is part of it and being able to improve your mobility, et cetera. And so we were able to find 3 of our therapists are up there as well.
All right, great. Last question here, nasal or oral swab were used?
It's a nasal swab.
Nasal swab, okay.
Now, yeah. The antibody testing is obviously, it's not a nasal swab, but everything else that we've used were the nasal swabs.
How do you determine who gets the antibody test and who gets the nasal swab?
Well, largely we're doing the rapid test, which is an antibody test. Largely we're doing that now with the patients on our COVID unit because, it's a matter of knowing when to test them. Because if we've seen some negatives and then it comes back positive the next time. Well, the way the rapid test is set up, there are 2 different antibodies, one that shows up early on in the viral process, and then the one that's more of the chronic one. If we rapid test them and we see that it's the IgM, the one that comes early on, if that still lights up, then we know that we probably aren't far enough along in the disease that they would get a negative test. That way you're not wasting a lot of tests with somebody day after day that may still test positive.
I guess the last, okay, this is back to the employee who did not test and is no longer employed. Was that a mutual agreement to leave, or was it if you do not get tested, you can't be working here?
Well, we didn't even have time to have that discussion because this particular employee just chose to go ahead and leave right then and there and chose not to come back. So we weren't even able to get to that part of the discussion. So.
And on the COVID unit, you already mentioned a number of people have recovered. What's been the average time that people have spent in that unit, and even a range?
Oh, wow.
Go ahead, Joni.
No, that's a good question. The lights just went here. I'm trying to think, I think the soonest somebody came off was less than 2 weeks.
Yeah.
We still have some, we have the 4 that are on there have been there since, maybe 5 weeks, 6 weeks.
It's so, going to
It's
that
very-
question, there's no rhyme or reason, I guess is what I'm trying to get at.
Yeah.
Some people it's, quicker than others. We require 2 negative tests in order to graduate from the unit. And, we've had some cases where, it's taken a lot longer to get that second negative test than it has for others. So there's no necessarily a blanket time that, after such and such, or, many days or weeks, then they'll come back and test negative. It's just based on the individual.
Okay.
And that's 2 negative tests and being asymptomatic, but we've seen that some of them who tested positive were not necessarily symptomatic.
Right.
They may have had some clinical issues prior to that weren't necessarily COVID symptoms.
Okay. Good information. Yeah, I've heard people have it for weeks and upon weeks. We have a board member who came down with the disease, and he's been down for 6 weeks. So it's certainly not a predictable disease by any stretch of the imagination. So thank you, Brian and Joni, for joining us. If you have additional questions, please put them in the chat and we'll get them to Brian and Joni. I'm going to turn it over to Elise now. She's going to give us an update of what's happening with the statewide testing, reopening plans, and other stuff. So Elise?
Hi, everyone. Thanks, George. That was great, really informative and interesting to hear how members are implementing plans for long-term testing as we move into this management phase of the pandemic. Wanted to provide the group with several updates and open it back up for any questions. First, wanted to just update on the governor's testing initiative. As of this morning, approximately 400 facilities have been tested. That does not include nursing facilities that are performing their own testing or those who have had testing following April 15th or up until April 15th. So the state still has far to go in completing this directive. And again, they were given a 2-week timeline. So I don't think that they'll be on target to finish by the end of this week, but we'll be receiving updates. Also, testing results are beginning to trickle in, but we were informed this morning that there are delays due to lab capacity. This has been a concern of ours from the beginning when we're testing and waiting for results to come back 7 days later. What is the value of, supplying those tests and performing those tests? So it's unfortunate to hear that they are seeing delays in receiving testing results. And I know some of our members are on day 7 now. Were tested as early as Monday or Tuesday of last week and still haven't received those results. If you're a facility that is told for any reason that you are unable to access results or don't have access to results, it's important that we are notified immediately so we're able to elevate that to leadership at HHSC. If you'll remember, we were concerned about providers receiving results of staff and residents directly, but avoided that issue by having DSHS Commissioner Dr. Hillerstadt as ordering physician to avoid that. So it shouldn't be happening, but some of you have raised concerns. So if for any reason you're told you cannot access results of your residents or staff, please notify us as soon as you can so we can help resolve that issue. We are also waiting on more detailed guidance on reimbursement for facilities performing their own testing. Last week, we discussed how working with private labs and billing differed across providers, and you all had shared several different experiences with related to billing. But the state is currently working through a reimbursement structure. We've requested that they also consider administration of tests by your clinical staff as well as use of PPE. So we're awaiting more details there. We're also working with the state on implementing reopening guidance, specifically for nursing facilities and assisted living facilities. CMS put out a memo early last week that really was to serve as criteria as states develop plans for reopening focused on visitation. We'll be submitting recommendations within the next couple of days to the state and working with other provider associations on that initiative. We received an update this morning that the FEMA PPE shipment window is this week, the 26th through the 30th. That gives 4 days for FEMA to directly ship over 1,200 PPE shipments. So please let us know if you receive those shipments or do not receive those shipments. We're really interested to get member feedback as well as what are in those supplies. So please be sure you're keeping us updated on that. HHSC is also developing a plan to return to routine survey activity. We're told that they are working through more of a long-term plan, but hope to return to routine survey operations by September 1. Currently, they're focused on infection control surveys as well as responding to priority 1 level complaint investigations. But we could see more routine survey operations within the next few weeks. So we want to notify members out there that could be taking place depending on what region you're in and what bandwidth looks like. So please, keep communicating with us any concerns you have as that may begin. We are also working with Texas Hospital Association to develop a long-term hospital-based testing plan. You'll know that we have been encouraging the state as well as hospitals across the state to test residents upon discharge back to a facility, both nursing facility and assisted living. So we're working with the Hospital Association as well as HHSC and the governor's office to develop a plan, and that's moving along. Also, late last week, we received verbal confirmation that a Medicaid increase for those of you serving Medicaid beneficiaries had been approved by the state. However, Texas HHSC is still working on that rate methodology and how that rate increase will be distributed. As soon as we receive more details on that, we will also share them. And I just wanted to make one more note regarding the reopening plan and that anticipated timeline. Right now, the state is preparing to have a plan finalized by mid-June. That doesn't mean that a light switch will be turned on and visitation, will be permitted or guidelines loosened in those settings. However, the state does have a goal to have a plan adopted. It will most likely look like a staged or phased-in plan. It could be regional. It could be facility-specific. We're talking through that. And I've also enlisted several members to provide feedback to us on recommendations for reopening. So we will definitely share that. Hopefully it'll be included in the Thursday newsletter. Our recommendations will be included in the Thursday newsletter. And that's all I have, unless anyone has questions.
I know there was just a question posted or a comment from Amy saying that the state just called wanting them to send them the results, but they don't have the results. So it's, yeah, it just seems like one hand doesn't know what the other is doing here, but we will definitely share that.
One thing I continue to encourage, as I know members are communicating with multiple agencies or authorities, you know, the local health departments or their regional directors at HHSC. Your regional director serves as your point of contact on the testing initiative. So if you're having side conversations with your local health department or the fire department or whatever entity is directed to perform the test, please make sure that you are communicating those conversations back to your regional HHSC program manager or regional director. It's important that they are aware of any concerns that you have, any issues are relayed back to them, and also, you know, continue to encourage you to send them our way to resolve as well. But I just want to encourage you all to continue, you know, over communicating with your regional directors on anything related to the governor's directives that they're not included in.
We did have a question. Are many ALFs testing, or assisted livings, are they testing voluntarily staff and residents? And I don't know as a state if many are, but if you want to, and we know that PVN did, but if you want to just post in the chat if you've tested your ALF residents and staff, that would be helpful to us. Okay, I'm going to turn over to Ann now to give us a little PPE update from the supplier side.
First, I wanted to share that one of our members has identified a touchless thermometer that is a more cost-effective option to the infrared thermometers that we've been seeing lately. It's around $44, and that is from iHealth. Also, some offerings from Value First. I mentioned this in our virtual conference last week. America Knits now has a level 1 isolation gown. They also have identified a COVID-19 test kit through strategic lab partners. Now, this isn't the lab offering, these are the test kits only. And that will be going out on our PPE alert later this afternoon. Also, I wanted to dovetail what Joni said about working with your distributor partners. I've spoken with McKesson and Medline both, and they don't see a near end in sight for the allocation process that they have for their PPE supplies. They do, however, see greater allocation available in the near future. Both of them have programs that allow you to access additional PPE that's outside of their allocation process. For example, Medline has an offering called it's called Spot Buys, and it allows you to buy outside of the allocation process, whether you're a Medline client or not. And this week's offering has disposable gowns, coveralls, face shields, bouffant caps, and shoe covers. So if you don't know, you do not have a Medline account or you don't know your rep, please reach out to me and I'll make sure and connect you to get that. We will also be sending out the updated PPE alert with a list of additional suppliers that we continue to update weekly. The only thing that's been elusive to find is the N95 approved masks. So once I do identify a source, I will be sending that communication out separately, so we're not waiting a full week. So if I haven't mentioned anything that you might need today, or that you've seen on the PPE alerts, please feel free to reach out to me directly. Thank you, George.
All right, thank you, Ann. Yeah, obviously the test is the biggest sort of item out there that
Right.
continues to be a problem for people to get, particularly the quick results. So, and then I also hear a lot of problems people getting gowns. So those sources.
Plenty of sources now, so that should be very helpful.
Okay. Michelle, do you want to give a little update from the risk management side?
Absolutely. I missed the first part of the conversation, but I will just say two things that have been kind of top of mind for everybody to frequently ask questions. One of them is, what do you do with staff who refuses to be tested? And do they have the right to refuse? And Corey and I worked a little bit on that last week, and Corey wrote a memo that, if you guys are not familiar with, is on the LeadingAge resource page. But he basically indicated, and there's Corey right there, that that they are not protected by the ADA, and the EEOC says you can test and you can condition employment on them being negative, COVID negative. And so we're getting that question a lot from other sources, and it's come up here. And Corey, did you want to say something about that?
Well, yeah, one thing I just would clarify, those would be sort of two separate items. Conditioning employment would be referring to future employees. And so I didn't find anything in my research that suggested, for example, you could terminate someone, an existing employee, for being COVID positive. But the EEOC has made clear that you can test just as you can require, drug testing or other types of testing in a pandemic. And they actually published this guidance in swine flu, in response to swine flu, and updated it for COVID to say that it falls in, the basic legal issue is that, there's an exception that allows you to kind of inquire about people's health in certain ways which would otherwise be prohibited if that person potentially poses a direct threat to other people. So the idea is, you can do this because of the extreme risk that COVID-19 presents to other people, and can require screening or testing just like you would with drugs, for example, if there's a real connection to the job, and obviously there is with COVID-19.
Mm-hmm.
So that doesn't mean it's the answer, or that you should, take the approach of firing people if they won't get tested. But I think it provides some comfort for those that have concerns about, about requiring testing, especially in a situation where the state is mandating it. So you kind of have double, I would say, sort of double protection, in the sense that you can first point to these, this guidance from the EEOC, and you can also point out that this isn't something you're unilaterally imposing, at least in this skilled nursing setting. You're saying, we've been told that we have to do this, and so we're requiring it.
Thank you.
Mm-hmm.
The other thing that I would bring up is that we created a risk acknowledgement. So just like when someone moves into any type of facility, you acknowledge that there's certain risks. When you go to the gym, you acknowledge that there's certain risks with the equipment that you're using. And so we created a risk acknowledgement related to COVID-19. And we would encourage facilities, when they're doing new admissions or even readmissions, that they sit down, have the conversation virtually, if that's the way you're doing it, with the family or whoever's signing the paperwork, that they realize that there is a true risk in any long-term care setting, that if COVID is in the building, that there's a possibility that they would be exposed to that. And I don't think we've sent that to LeadingAge, but we could send it. We'll send it to you guys, and you guys can determine if that's something you want to put on the resource page.
Okay, great. Thank you.
Mhm. Yeah, and once again, Corey was very helpful with that, reviewing it and making sure that it was appropriately worded and could be used throughout different communities. So,
Okay, thank you, Michelle. I also want to point out, I put in the chat there's a link to an interview from a nurse that works at PVN that works in the COVID unit, and it's really great. So I'd urge you all to look at that. Really speaks to our whole field, and particularly to nonprofits and the whole mission-driven angle about why people work in our field and work for it for the right reasons. So if you get a chance, please take a look at that. Okay, well, I think that will do it for today. I want to thank everyone for participating today. Again, Brian and Joni, thank you for your presentation. Thought it was great. Really hit home on a lot of the issues that are hitting our members right now. I want to remind everyone that this Thursday at 4 o'clock, we're having our C-suite call. So we'll probably be focusing on reopening strategies, a lot of the things that we touched on today, but I know some members are moving ahead with some reopening strategies. So we want to make sure we get, as much good information as we can. So also want to thank all of you who participated in the virtual conference last week. It was a great conference, and particularly want to thank Nicole for moderating the happy hour. I thought that worked out really well. So we're going to try that again sometime in the future. We had a keynote speaker, and she joined us back for the happy hour and had some really good insightful conversation about sort of the whole, the attitude that we need to bring during a crisis. And so I thought it was very, very apropos for what everyone is dealing with. So for those RRG members, if you want to stay on the line, we'll start that meeting right after this. And I will see many of you on Thursday, if not next week. Thank you.